Are you trying to heal from a chronic disease, but you can't sleep? My name is Dr. Erica Steele. I'm a board certified naturopathic doctor. I hold 6 degrees in my field. They're all in the natural healthcare space. I like to say I went to school so you don't have to. All right, let's talk about the connection between sleep and chronic disease. Again, like I've said in my other videos about sleep this month, I feel like it's kind of like this missing piece. It's so simple, it's it's missed a lot and not considered as a part of the healing process. I mean, think about it. When you're going into a hospital facility, right? They have rounds, they have vital signs, you've got beeping, you've got noises, you've got, people coming in and out. It's not a restful environment. So if you are in a hospital setting, you may want to speak to, whoever's in charge of your care team, the charge nurse, etc., to maybe create a schedule where at least you can have a little bit more extended time to be able to sleep. Because with all the broken sleep, that's not going to help your healing process. And if you're in an acute situation where, let's say, you're in a hospital, getting sleep is very, very important. And again, it's highly overlooked. The other thing to think about when you have a chronic disease, some of the implications I see with sleep is, again, like you're in pain, you're not feeling well, you can't get comfortable. These are all different experiences that can affect, your sleep pattern. Because let's say if your pain is a 9, you're not sleeping like that, And so I often tell people, especially who are drawn to more of a holistic lifestyle, who kind of almost sometimes look at it as a failure if they have to take a pharmacological agent. And I just want to reassure those people, taking a pharmacy is just a stabilizer. Really no different than taking an herb. An herb is a pharmacy too. And in fact, a lot of pharmaceuticals, if not all, have herbal implications as their derivatives. And so I want to make sure that everyone knows, if you are in pain or you have a chronic illness that creates pain, like fibromyalgia or something like that, and you are walking around and trying to sleep and your pain level is a 6 or above, please, please, please speak to your provider and get some pain management. And so, especially in an acute situation, post-surgery, etc., do not be a martyr. Do not try to take one from the team, even if, it's a anti-inflammatory or even an over-the-counter pain relieving medication. Something is better than nothing. And again, 6 out of 10, right? So 10's excruciating pain you felt, never in your life or whatever, hopefully never. 0 is you don't feel anything at all. If you're at about a 6, we need to bring that down to, 4 and below. The lower the number, the better. Naturally, 2 is great. And the reason being, again, because your nervous system, when your pain receptors are constantly firing like that, your body, let's call it a workout. It's almost like your body is getting a workout, and not in a good way. It's exhausting. So your body's already coping with whatever disease process is coping with it. You're trying to build health and stabilize the health of the individual, or of you, if it's you or a family member, etc., right? And so as you're trying to do this, it is going to take some time. And so if you are in pain and you're constantly running those pain receptors, it is going to inhibit your ability to heal, and more specifically, your ability to sleep, which is my point. So if you're at a 6, make sure you're at a 4. No shame in anything that you need. I broke my neck many, many years ago, and I remember I was a massage therapist at the time, so I was still very, I've been in this thing my whole life, but in terms of a holistic lifestyle. But I remember, I had a concussion, I was out for 2 weeks, etc. And I remember coming to and then offering me pain meds, and me, of course, being such a purist, going, no, I'm not, I don't want that crap. I use some other words, but I don't want that stuff. And then it wore off, and the excruciating pain of a neck break in a halo, because I woke up in a halo, insane. So I can tell you from firsthand experience, and I'm sure many of the healthcare professionals that watch my channel can also attest, please do not be a martyr. Do not try to power through. There are some natural pain options available. I find that it's a little bit better topically, when you do like CBD topically for regional pain, but that's better for something like pain strains, things like that. again, taking anything for long periods of time can have some implications from it. But again, those are conversations to have, with your doctor. Be mindful, especially when you are, and I probably should have said this in the mental health video, with experimenting with taking different supplements, because they can have interactions with your medication. So definitely be mindful of that as well, especially if you're on a psychotropic medication. You don't want to take things like St. John's wort to be able to sleep. Melatonin, sometimes I feel like melatonin's a little controversial. If you already have, a serotonin challenge, if you're already more on the depressive side, I wouldn't recommend melatonin. I'd recommend more 5-HTP. If you want to learn more about why, it's biochemically, if you're constantly taking the melatonin, the brain will, get used to it. Dosing needs to go up, etc. And again, it will downregulate serotonin after a while, which we don't like. So if you want to learn more about the more in depth, I don't want to get too granular in this video, because, the webinar is really designed for people who want to really understand and learn more practically what they can do specifically related to their sleep. The other thing I'll also say too is, if you have somebody who's chronic disease and they're sleeping a lot, we want to make sure that you're moving them, they're shifting them around because of bed sores, etc. Changing sheets often, because they're laying in that, so all those skin cells are going too. So you don't want them not only to get bed sores, but you don't want them to get skin reactions or skin infections. So consider that as well, and really try to, it's a lot to do with mindset healing. I mean, I think there's a lot of creators have talked about it. I've talked about it before in terms of belief, and even Dr. Bruce Lipton talked about the biology of belief. And so we want to make sure that, number one, you believe that you can heal, because that's going to help rest. Surrender over what you can't see possible to a higher power, and really practice also grieving. I know that can be challenging, but sometimes we need to process through what is going, actually all the time, we need to process through what is going on with us physically, emotionally as well. So definitely, if you are struggling with a chronic disease, a lot of it has to do with suffering. And so we want to get that out. If we don't get whatever is, mentally, emotionally, physically, spiritually impacting us, then it can continue to make us sick. What do they say? If what stays in the dark stays in the dark, then it keeps us sick. I don't know. I butchered it. Whatever. So anyway, if you want to learn more about what you can do about your sleep and you struggle with chronic disease, go ahead and check our instant webinar below. And I go way more in depth than I do in this video, more practical, more things to look for, more things to consider, and how I can help you or teach you and your family to live naturally. So thanks so much for checking it out. Please leave a comment if you have any questions, and like, share, subscribe for more.